Next, I'd like to ask Anja Mikic to come up. She's the Nourishment Concept Lead for the International Wellbeing Institute, and she's going to talk about leveraging the built environment to advance dietary and planetary health. Anja.
Thank you, and good morning. My name is Anja Mikic, and today I'm going to try to let us really speak about the connection between our immediate environment, our health, and the planet. So we're really going to build off of the conversations that Dr. Parkinson and Dr. Hu started for us yesterday and this morning, and really think about the way we can design our spaces and to make the easiest choice the healthiest choice. So once again, my name is Anja. I serve as the Nourishment Concept Lead at the International Wellbeing Institute. And my primary role is to really translate decades of nutrition research into implementable and feasible built environment strategies that we can then apply in buildings around the world. And like many of you here, I was initially on the track to medical school until I really became passionate about nutrition, because I think there's a lot of preventative medicine and really just preventative power of nutrition. And I didn't really think about our environment because when we talk about nutrition, we usually talk about just in the individual and one person at a time. And so it wasn't until I was introduced to the healthy building movement that I really started thinking about the way our environment affects our choices and how we can really design to mitigate these obesogenic environments, and how do we to really set ourselves up for success. So what do we talk about when we talk about health? So I love this definition by the World Health Organization because it really breaks down health into three main components that are all interconnected. So we have physical health, we have mental health, and we have social well-being. And it's also important to note that our health, just because we're healthy doesn't mean, or just because we're not sick doesn't mean that we're healthy. So when it comes to diet, our diet affects all three of these components. We already know that it affects our physical well-being, it has effects on our cardiovascular health, our metabolic health. There's also growing research between the gut and the gut-mind connection and how nutrition plays a role in stress management and our mental health. And also it's probably at the center of our social well-being because a lot of our social activities revolve around food. But we know today that our health is based on far more than genetics alone. And so if we take a look at this pie diagram from the CDC, we'll see that genetics only impacts about 10% of our health. And when it comes to diet, our genetics only impacts about 5 to 10% of our risk associated with diet-related diseases. And as we kind of mentioned yesterday, our zip code is really the largest impactor, has the largest impact to our health. So when we look at the physical and the social environment, the biggest piece of the pie right here, we can think about the built environment, so how our spaces are designed, so like how this room is designed and what that means to our health, and also social determinants of health, which includes income levels, education, and our access to a variety of opportunities. And then we can also take a look at lifestyle and behavior. So what are we doing every day? Are we active? Are we smoking? Are we eating? Are we drinking? That all kind of ties into this lifestyle management that Dr. Parkinson just discussed. So if we really want to impact health, then it's this piece of the pie, the biggest piece of the pie that we want to focus on. But our environment is changing, and it's also changing the way that we live. So currently in the US, we spend 90% of our time indoors. And by 2050, the UN projects that about 68% of the global population will live in an urban area. So more and more of the population is going to become urbanized and probably spending most of their time indoors. So that really means that when we think about the largest piece of that pie, it's the indoor environment that we want to talk about. And my goal today is really to kind of show you that our physical environment directly impacts many of our health-related behaviors. So what if we positioned our buildings as preventative care and as agents of public health? And if we took a preventative approach to our health and well-being? Because I think it's time now that our buildings can actually do more than no harm. They can actively promote our health and well-being. And so in our research, we found that we need a comprehensive approach to addressing well-being in the built environment. And based on the WHO definition of health, we address the 3 pillars. We address physical well-being, social well-being, and mental well-being through 10 concepts or topic areas. And this includes looking at air and water quality, and if we have the indoor air environment and water quality to support health. This also looks at addressing nourishment in the built environment. So what kind of foods do we have available, and also what kind of opportunities for food production do we have available. We look at lighting, so promoting daylight and creating optimal environments for light that support our circadian rhythms, and also movements, creating spaces where you can actively walk around, engage with the space, and also supporting active transportation. And comfort, we take a look at thermal comfort and also acoustical comfort, and also address material health. And the mind and community categories are particularly interesting because this is where we focus on the connection between mental health and also supporting inclusive design. And so biophilic design is a really hot topic too. It's our biophilia is our innate nature to connect, and our innate ability to connect to nature, and it involves incorporating a lot of designs such as plants and water into our spaces, and also other elements. So just this space today, this is a really incredible space because I get to point out a lot of really cool features, because FIPS is certified in so many of these rating systems, and I'll discuss that later. But just looking around, if we had these shades up, you have access to daylight here, you have these beautiful views to nature. This is a phenomenal space. You have connections to biophilia right here at the Botanical Garden. And if we start bringing this in, there's research that shows that it has the ability to lower our diastolic blood pressure, it alleviate stress, also help with pain management if we're thinking about hospitals and designing healthier spaces. So this is essentially what WELL is. It's a collection of best practices that's in a global standard, and every project that's WELL certified is verified on site by an assessor who comes to make sure that the building is performing accurately, that the air quality comes to test the air quality, comes to test the water quality, and also my favorite, to check that there's actually fruit bowls instead of candy bowls. And so while we know that health is not merely the absence of disease, a healthy building is not merely good design. So when we design for health, we also can consider the organizational policies that can support the people in the buildings. And this is has to do a lot with the changing culture. How do we begin to implement these policies that actually allow individuals to get up and take a midday stroll, or to eat away from their desks and mindfully with their colleagues? And then we can also look at performance. So is the building performing as it's designed? And also, are the people performing better? Do they report feeling less stressed? Do they report higher fruit and vegetable intake? What's the effect on their productivity? And so we can begin to look at all of this, and over the last few decades, the focus has largely been on environmental sustainability, and we've gotten really good at building green and sustainable buildings. And the point I want to make here is that what's good for our health is also often good for our planet. So the healthy building movement is really an extension of the same conversation that we've been having with the sustainability movement. And now we're expanding that focus to focus on human sustainability and human health and wellness. And so our CEO, he likes to talk about the second wave of sustainability. So the first wave of sustainability was really on minimizing the effects of the environment and protecting it. The second wave is all about how we can design our spaces to really promote and enhance our environment and the people in it. And it's really at the intersection of food, I think, that we see this the most. And so there are many ways we can optimize our eating environments, and we address a variety of different topics in the built environment when it comes to nourishment. But ultimately, the food we eat, the ways we produce it, and how much we waste all impact human health as well as environmental sustainability. So our goal here, the overarching goal, is to create a food environment where the healthiest choice is the easiest choice, because we are living in obesogenic environments, and I don't think that we're setting ourselves up for success. So today I'm just going to briefly cover 3 topics that are really hit the intersection of dietary and planetary health, where I believe that we can make small but significant changes to have a large and positive impact. So we'll start with fruits and vegetables, and we know that a diet that includes more plant-based foods, such as fruits and vegetables, and fewer animal foods is healthy, sustainable, and ultimately good for both the people and the planet. In our standard, we require that projects in certified spaces first ensure that there's fruit and vegetables available. So if they're providing any type of food, even in just vending machines, we ask that they still consider fruit and vegetable options to increase the availability of fruits and vegetables. And once we have fruits and vegetables available, how do we promote fruits and vegetable visibility? So we look at strategic placement and also choice architecture. So where can we place the fruits and vegetables at eye level to help promote their selection? Can we place them at the beginning of food service lines? There's a lot of research coming out of the Cornell Food and Brand Lab too that looks at choice architecture and the way how we make our choices. And so if we begin to put the healthier choices at the beginning of the food lines where we know we take the most food first, can we actually start having a greater impact on our diets? Also looking at menus, and I know Dr. Hu discussed menus of change. We're more likely to choose what we see first on the menu. It's what's on the top of the list. So can we start having healthier choices there? And there's also research to support that actually having increased fruit and vegetable intake or increased fruit and vegetable availability at work sites leads to increased fruit and vegetable intake. And so what we also hear is that individuals, when they start getting these healthy habits at their homes and in their workspaces and places where they live and learn, they take it home to their families and their household. So we're creating change here, but also it's spreading everywhere else. And the second thing that we can address is responsible food sourcing by requiring a selection of responsibly sourced produce and also animal products. So sourcing products responsibly minimizes the impacts to people, to animals, and to our planets. And from a nutrition standpoint, organically grown foods aren't necessarily more nutritious than their conventionally grown counterparts, but they do offer us plenty of other advantages. So organically grown produce has lower pesticide levels, and organically grown or raised animal meats have lower levels of antibiotic resistance. So I think those are all important to consider when promoting responsible food sourcing. And similar to fruits and vegetables, the first thing is that we want to implement responsible food sourcing. And so just having policies that support it, and then also how can we promote this through advertising and signage, and allow individuals to really be able to easily identify these sources. And lastly, we can look for opportunities for on-site food production. So food production is responsible for up to 30% of global greenhouse gas emissions and 70% of freshwater use. And growing food ultra-locally or even on-site has a lower environmental footprint and can also reduce food transport. So this is a really great example of one project in New York that incorporated food production on its terrace. So they have 2 urban gardening plots, they have hydroponic towers, and they also have they have a few apiaries. And the studio members all help to cultivate the garden, which includes many fruit and vegetable opportunities. And the research again behind this is that individuals who partake in gardening actually have an increased fruit and vegetable intake and are more likely to meet national recommendations for fruit and vegetables. And we're also seeing the same effects again, that they go home and so their household actually has an increased fruit and vegetable intake as well. And lastly, like I said, we are in such an incredible space. The Center for Sustainable Landscapes, which is just behind us, is the highest, really demonstrates the highest standards for health and sustainability. It was one of the first, or it was the first WELL certified platinum project. It has a tremendous a lot of other certifications, including LEED, Living Building Challenge, and I believe STAR Sustainable Sites. So I really encourage you to take a walk around this space, and also just to not take environments like this for granted, because this is such a privilege. And I hope one day that we can create this for everyone, and that the healthy building and a sustainable, and a healthy building and a sustainable building is a standard everywhere. So really just key takeaways here, thinking about our buildings as agents of public health, putting food at the intersection of people and planet, and then thinking about ways that we can use architecture and organizational policies to promote well-being. So thank you, and if you're interested in any of the recommendations, it's all free and available on our website, Well Certified. Thank you.